My name's Steve Larson. I'm a physician at the University of Pennsylvania, and since 2003 transitioning care to South Philadelphia, where I work with an organization called Puentes de Salud. We started with 5 patients, and then 10 patients, and then 20, and 30, 40, 50. Today, I think in our electronic medical record system, we have over 4,500 patients. This is a part of the University of Pennsylvania Health System's private practice, and they allow us to use this clinical space at night, 2 nights a week.
My name is Annmarie Avila, and I'm a 4th-year medical student at University of Pennsylvania. Tonight, I just saw a patient and helped counsel her on a new diagnosis of diabetes. And what's really cool about Puentes is that they have nurses called promotores, and they counsel the patients on a lot of the lifestyle modifications and a lot of the extra kind of counseling that you need in terms of diabetes. And so I was able to talk with her about medications, but then as she needs so much more education, I was able to bring her over to the promotores, and she's actually speaking to them now. This is the patient.
My name is Corey Simpson. I'm a dermatology resident at the University of Pennsylvania, and I come to Puentes to volunteer in the dermatology clinic. Puentes plays a unique role in the community. I mean, it caters mostly to Spanish-speaking population, people who have a lot of trouble getting access to care, even if they even if they happen to have a primary provider somewhere else, they may not feel like they're able to communicate with them very well. I think most of the care that's given here, they try to give it in Spanish so that people can feel like they're being understood and ask questions and get answers to questions that they have about their health. I think it has a unique niche in that it's mostly an immigrant population that we see here, people who aren't plugged into the system. They don't have insurance, they don't have access to normal routine kind of care. So I think it's very important that we have an outlet for these people to seek care.
The people are wonderful. They're so grateful. The humbleness that it brings just keeps me very humble, and that's a big gift.
Since 2010, we've been in this physical space. It's always been apparent to us that we would need to be able to create a true medical home for the community. I'm excited to say that's where we are today.
In the new space, they'll have upstairs, there's a yoga studio, and they're also going to have art, and they're going to have a classroom where they're doing ESL, so English as a second language, and then GED certification for high school students.
When I look at healthcare and I see the model that's constantly being replicated, it hasn't changed to meet the needs of our society. It's not going to be me that finds the solution. It's going to be the next generation of kids who are coming down the pike asking the hard questions. Why do health disparities exist? Why are access to care issues? So what Puentes is, from my angle as a professor and a teacher, is it's a learning environment where kids can come, ask those hard questions, and very quickly get to a level of understanding that took me 20 years to get to. I can accelerate the process, and then in doing that, hopefully create the foundation for them to bring ideas and solutions. So to me, that's powerful.